Let's take a look at the gender-related behavioral and cognitive differences that are known of. There are some gender differences in cognitive ability that have been studied. There is much overlap between males and females, so let's remind ourselves that some of these differences are statistically significant, but not true for everybody. Differences are task specific. So for example, females score higher on verbal fluency and writing, but not reading comprehension or vocabulary. So we can't just say that it's like verbal versus mathematical. It's a little more fine than that. And so let's take a look at a particular task here, a spatial rotation task. And you would be asked to look at these two figures and ask if they are the same shape. And so that to be able to answer that, you would have to be able to rotate these figures mentally in your head and determine that. And so that's an example of a task that does show some gender-related differences in that males tend to perform better on this task than females. Now what's interesting is if you change testosterone or estrogen levels, you change the resulting behaviors and the performance on these tests. So transgender individuals who take estrogen get better at verbal fluency, but get worse at spatial rotation. So the pattern starts to shift as hormone levels are changed and as estrogen levels in particular start to increase. Older males who take testosterone supplements see an improvement in their spatial skills. So testosterone levels tend to decline as men get older, and supplements that increase testosterone levels also have a corresponding effect on spatial skills. There are also sex differences in pain tolerance, stress reactions, and susceptibility to various psychological disorders.